Hi, my name is Krista Bose and I was diagnosed with osteosarcoma in 2018. I first recognized that something was wrong about a year before I was diagnosed. I was feeling really tired and I was having episodes of shaking and feeling sick, and I kept going back and forth to my GP saying I think something's wrong, and they had put it down to anxiety. I was studying at the time in medical school and I thought it was all just stress from exams, and I even at a point thought I might be gluten intolerant, so I went off gluten. And then after some time I noticed a lump in my leg, and when I showed that to the GP they thought it's just a sport injury, so just ignore it. And then I went to Prague on a medical student elective, and while I was there I made a bet with a doctor over Wimbledon tennis tickets and ended up getting an MRI because I'd been complaining about pain in my leg, and then they found the tumour then. It was a bit of a surprise, a shock really. When I was in Prague and I had the MRI scan, obviously nobody was expecting to find a cancer. They thought it might be a tear of a muscle or an injury, maybe even a hematoma, collection of blood within the muscle in my leg. So everyone was shocked, and I was on a program doing surgery as a medical student on other people. So it was really ironic that I then got taken in to become a patient. And I was brought into another room. Quite a few nurses came in, but they only spoke Czech. Nobody really spoke English. I didn't speak any Czech. So I was told to call one person. So I called my best friend Josie and told her what they'd found, and she said, just get on a plane, come back, and we'll figure it out. So I went to the airport, got on a plane, and then instead of calling my doctor, I don't know why this sequence of events happened, but I decided to call the doctors that worked at the medical school that I was attending. I just didn't know the process, because I think normally if you're diagnosed by your GP, they tell you a plan, but because I was diagnosed abroad, there wasn't really any plan. And when I called the medical school, I obviously knew a lot of doctors on the course, and I said, I think I've got a bone cancer. Like, I don't know what to do. Where do I go? And they were really great. They were in my corner and they helped me, guide me into the right stream. I did end up seeing my GP, but it was a different GP than the one who'd missed the bone cancer. It was a different GP in the practice. And then afterwards, they directed me sort of roundabout ways, eventually to UCLH and the Stanmore, where I was diagnosed officially with osteoblastic osteosarcoma. I've had a lot of treatment for my cancer. The first line treatment that I had was MAP chemotherapy, which is cisplatin, doxorubicin, and methotrexate. And it's a 5-day infusion chemotherapy that you get your PICC line and you wear it on your backpack for 5 days. And then I had that for 3 months before I then had my limb sparing surgery. So I had my femur, my knee, the top half of my tibia, and all of my 4 quads in my left leg removed. And then when they looked at the tumor under the microscope at that point in my treatment, they found, unfortunately, that the tumor had grown quite a lot in that time while on chemotherapy. So they thought it would be prudent at that point to switch chemotherapies. So I then was started on ifosfamide and etoposide, which is another type of infusion chemo that you have over 5 days. And then I also started immunotherapy, which is MEPACT or mifemertide. And I did chemo until January 2019 and immunotherapy until July 2019. And then I had a bit of a break before I was re-diagnosed. I was re-diagnosed with metastatic disease in October of 2020, which was about 1 year after I finished all of my treatment for the first diagnosis. I was having lung surgery for what they thought was endometriosis, which is when a part of your womb, of your uterus, grows in a different part of the body and starts shedding exactly like you would get a period. It could shed anywhere in the body and then you have bleeding. And they'd seen something on my scans, but it didn't really look typical for a bone cancer metastases. So they were convinced it was this benign condition, this endometriosis. And I had an operation, and unfortunately when they looked inside to try and remove this supposedly benign thing, they found hundreds of tumours within my pleura and in my lung. I had a little bit of a wedge resection, which is basically they just take the chunk out of the bottom of your lung. And then when I woke up, they told me it was metastatic disease, and I started my third or fourth line treatment. My third line chemo, but my fourth line treatment, which was gemcitabine and docetaxel. And then I chose, maybe rightly or wrongly, to stop treatment in order to finish medical school. And in that time, my tumours grew again, and I was luckily then started on the drug that I'm taking now, which is cabozantinib, my tyrosine kinase inhibitor. So when I was diagnosed with metastatic disease, I was told at that point that obviously I needed to restart chemotherapy, which would make me neutropenic and vulnerable to infection. Unfortunately, this was also during a COVID pandemic, which doesn't really help. And I was told that I should quit school. I was advised not to apply for foundation training for junior doctors because I would be very unlikely to succeed in medical school if I couldn't attend to placement. And that was probably the worst of it. You know, getting metastatic disease is obviously awful, but finding out that like your biggest goal and you're so close you can't just finish, it was heartbreaking. But I applied anyway. Which is great because I ended up stopping my treatment once it was a bit more stable, and I ended up going back to medical school and doing a condensed course in another 6 months of training, which I just had to do overtime hours and extra days and things like that to make up for the time I'd missed on chemotherapy. And I managed to pass all my exams and finish, and I qualified as a doctor in June of 2021, and now I'm working as a doctor in Southwest London.